Hello friends, today we will discuss about nutritional plan for the diabetic patients during the Ramadan month. If you are new at this channel, please subscribe, like and press the bell icon button. Foods to recommended during Iftar. Iftar, the sunset meal, is the time when the person replenishes the energy levels. So, every effort should be made to consume foods from all major food groups. Iftar also needs to provide a quick release of enough energy. Iftar should include the following foods. First is dates. Traditionally, during Ramadan, dates are eaten at the start of Iftar to symbolize the breaking of the fast. They are a quick source of energy and are high in fiber, calcium and iron. However, the number eaten should be limited as dates are high in sugar. Complex carbohydrates. It is recommended to eat meals based around small portions of starchy carbohydrates such as whole grains, rice, or flatbread in small portions. Have whole grain sources of starchy carbohydrates such as lentils, quinoa, buckwheat, bulgur wheat, and couscous. Meats and alternatives. Incorporate protein-rich sources such as lean meat, skinless chicken, fish, eggs, legumes, and low-fat dairy products. Healthy meals. Avoid the uses of deep fat fryer during Ramadan. When using oil for cooking, try to measure oil and avoid deep frying. Reheated oil increases the amount of trans fatty acids which are bad for the heart. Limit the number of starters at iftar, especially if based around fried snacks such as samosas. Any starters should be based around salads, fruits, lentils, or soups to leave room for the main healthy meal of the day. Reduce intakes of processed foods. Avoid deep-fried foods and those that contain refined carbohydrates such as white bread, pastries, biscuits, and baklava. Avoid processed meats, burgers, fried chicken, and chips. Have small amounts of foods like baklava and halwa made with semolina, butter, and sugar. Salt. Reduce intake of salt and salted food including dressings, sauces, salted nuts, and cheeses. Dehydration is a risk due to limited fluid intake during the day, and high salt foods can further increase this risk. Fluids. Drink plenty of water at iftar. It is recommended to drink at least 8 cups of water between iftar and suhoor, so that the body may adjust fluid levels in time for the next day. Again, avoid drinks that contain caffeine, such as tea and coffee, as this can make the person lose more water by going to the toilet more. Avoid sugary drinks such as orange, apple, and tropical fruit juice and fizzy drinks. Drink diet drinks and non-sweetened drinks such as unsweetened lassi or laban are a preferred option. Physical activity and fasting. People with type 2 diabetes may continue to exercise during the month of Ramadan and continue their daily routine, particularly in morning hours. But they should not exercise excessively 1 or 2 hours before iftar. Although rigorous exercise is not recommended during fasting because of the increasing risk of hyperglycemia and dehydration, people with diabetes should be encouraged to take regular light to moderate exercise during Ramadan. Individuals should be reminded that the physical exertion involved in Tarawih prayers, such as bowing, kneeling, and rising, should be considered part of their daily exercise activities. They should also check their blood glucose levels if they feel unwell or faint during or after exercise. Finally, Eid ul-Fitr. After the month of Ramadan, there is the celebration of Eid ul-Fitr. During this, people with type 2 diabetes should try to minimize or avoid intake of highly processed and fried foods, such as deep-fried snacks including samosas, pakoras, chips, and fried potatoes, and minimize the intake of sugar-rich sweets such as baklava, halwa, kheer, and Indian sweets.